Hello, Dr. Andrea Garraway here. I had the privilege of sharing information with you all at our Bible study workshop conversation a couple nights ago, and I thought it would be important for us to have that very information somewhat in a capsulated format, somewhat in a way that you can have it as a resource, maybe something that you can refer to. And then if you have any questions, you could have that as a base, be able to form your questions. So really creating this as a recap, but also as another educational tool for you to be able to have at hand. I will be using the exact same presentation, so you're going to see me looking back and forth. I'm just going to refer back to the PowerPoint so that the information is the same. In case you were taking notes, you can follow along with that. And then hopefully at the end, you would have captured the resources that was dropped into the chat box for you. If not, I can always attach it to the end of this for you. All right, let's jump in. So the very first thing we talked about was, what is depression? Depression kind of goes by several names. There's clinical depression, but most commonly there is major depressive disorder. There's different types of depression. We didn't talk about those different types of depression, bipolar, etc., but just know that there's more than one types. This was just baseline, right? That's what we discussed. Now, this disorder is considered a mood disorder, and it is distinguished by consistent sadness or lack of interest in life. Now, we did discuss that most people feel sad. That is normal, especially when there's loss in life, or maybe there's life challenges, there's grief, etc. That is normal. However, what is not normal is to feel a sense of hopelessness, helplessness, and worthlessness. And we discussed a little bit about how this was correlated in scripture. We were able to point to some of this in scripture. And we also talked about how this depression, this disorder, how it's curable. This does not have to be a lifetime sentence if it's something that you have experienced. We can support you to get over, get through, get around these depressive mood. Now, in order for you to be prescribed or diagnosed with depression, you have to have 5 or more symptoms lasting about 2 weeks. So feeling sad for a day, for a moment, doesn't mean that you're depressed. But having some of these symptomologies that I'm going to share with you consistent most all days for 2 weeks, that is diagnosable. Let me share some of them with you. So having this depressive mood most all days. Sometimes it is most noticeable in the morning, early morning, or late at night because we're sitting still. We're not busy with the day's activities, so we then notice it there. However, if in the middle of the day we stop and we tune in, we kind of feel it. But because at night or like in the morning that we're like, the world is quiet, it seems to be amplified. It's a bit louder. There's tiredness. There is a lack of energy or low motivation to do the things that you used to do. There's that sense of worthlessness, guilt. Maybe there's some crying spells that's attached to this. We find that we're pessimistic about our outlook in life. We have a hard time focusing, remembering details, or making decisions. Our sleep is disrupted. There is a lack of interest in things that we are familiar with, things that we used to do. Perhaps we used to like to go to Bible study, showing up for that. All of a sudden, we're no longer interested in doing that, right? There is often thoughts about suicide or death, right? Even if we are noticing conversation, just there's a fear of death, you may ask yourself, where's this coming from all of a sudden? There is this feeling of restlessness, slowing down, cranky, maybe irritability. We notice that there's overeating sometimes, looking for comfort, under eating sometimes, feeling like there is no desire to eat, nothing tastes good. Some things that we emphasized a lot was the physical piece of it. There's that headaches, there's cramps, digestive issues, there's joint pain, there is back pain, etc. We did talk about its prevalence. We discussed what does that look like relating to gender. And research shows that 80% of women tend to be more susceptible to depression versus 40% in men. So we did discuss that. Also, contributing factors. There is family history, so genetics. There's also the chemical imbalance in the brain that may contribute to this. We talked about hormones, pregnancy, postpartum, thyroid, menopause as some of the things that may trigger depression for us. Also, there are those life difficulties, maybe even a traumatic event that happened in childhood and it is unresolved. So we might have noticed abuse, neglect, or maybe violence. We also discussed drug use specific to alcohol and marijuana, but we know that all drug use is included in that spectrum. Other contributing factors is age or gender, increased stress, right? Maybe like a chronic health illness that may also contribute. We talked about some warning signs. We discussed four. We talked about the emotional signs, whether there is anxiety, anger, irritability. We talked about cognitive signs that can be disorganized thoughts, a negative view, feelings of isolation. We belabored the point of suicidal thoughts. Then there is the physical piece. We talked about, the joints, that feeling sluggish, irritability. And then we also mentioned that behavioral piece, which could be avoidance, withdrawal, maybe even change in sexual appetite.